The future of cancer detection in a single drop of blood. Imagine being able to find a tiny cancer tumor anywhere in your body with just a simple poke in your arm. Most people do not realize that your blood actually carries secret messages from every single cell in your body, and we have finally learned how to listen to them. This is not science fiction. It is a reality called liquid biopsy, and it is changing everything we know about how to find and treat one of the world's scariest diseases. Today we are going to look at why this blood-based testing is a massive breakthrough for patients, families, and doctors. Traditional biopsies usually involve surgery or long needles to cut out a piece of a tumor, which can be painful and scary. But what if we could get even better information from a couple of vials of blood? In the next few minutes, we will explore how this technology works, why it was so hard to invent, and how it is giving hope to people who thought they were out of options. How your blood tells a story when cancer grows. It is a bit of a messy process. As cancer cells grow and divide quickly, some of them die off. When they break apart, they dump their internal parts, including their DNA, directly into your bloodstream. Scientists call this circulating tumor DNA, or ctDNA for short. Think of your bloodstream like a massive river. If there is a factory upstream, which is the tumor, it is going to leak specific chemicals or scraps into that river. A liquid biopsy is like taking a bucket of water from miles downstream and using high-tech tools to find those specific scraps to figure out exactly what that factory is making. This is a game changer because tumors are not the same all the way through. A physical biopsy only takes a tiny piece from one spot. If that spot does not have the specific mutation the doctor is looking for, the treatment might fail. But because a tumor sheds DNA from all its parts into the blood, a liquid biopsy can give us a big picture view of the entire cancer. This helps doctors pick the exact right medicine that targets the specific weakness of that specific cancer. It is like having a personalized map for a battlefield. The big challenge scientists had to solve for a long time, this was almost impossible to do. Why? Because finding a tiny piece of cancer DNA in your blood is like trying to find one specific grain of sugar in a giant swimming pool. Your blood is already full of healthy DNA from your normal cells, so the noise is very loud. Early tests just were not sensitive enough to hear the whisper of the cancer DNA. If a doctor missed that tiny signal, a patient might be told they were healthy when they actually had a growing problem. This led to a lot of frustration in the medical world. To fix this, researchers developed something called next-generation sequencing. These are super powerful machines that can scan billions of DNA fragments in a matter of hours. They use complex math and computer programs to ignore the healthy DNA and zoom in on the mutations that only cancer creates. Because of this, we can now find cancer DNA even when it makes up less than 1% of the DNA in your blood. This level of detail was unthinkable just 10 or 15 years ago. Why this matters for you and your family. The most exciting part about liquid biopsies is how they help in real time. Normally, a patient has to wait months for an expensive and uncomfortable MRI or CT scan to see if their chemotherapy is working. With a blood test, doctors can check the levels of cancer DNA in just a few days. If the levels are going down, the treatment is working. If they are going up, the doctor can switch to a different medicine immediately without wasting precious time. This technology also helps with something called minimal residual disease. After a patient has surgery to remove a tumor, they often wonder if the cancer is truly gone. A liquid biopsy can find those last few hidder cells that are too small for any X-ray to see. Catching those early means we can stop a relapse before it even starts. This is providing an incredible sense of peace and empowerment to families who are navigating the long road of recovery. We are finally moving toward a world where cancer is caught early, treated precisely, and tracked closely, all starting with a simple blood draw. If you want to see how other new medical technologies are saving lives right now, share and follow this channel.